10 silent kidney disease signs on your skin you shouldn't ignore. What if your skin, the very thing you see every day, was silently broadcasting a critical health warning you're completely missing? There are 10 skin changes happening right now that 99% of people dismiss as just getting older or stress-related. But they're actually emergency signals from your kidneys. One of these signs is so common that you probably have it and don't even realize what it means. Hey everyone, and welcome back to the channel. Your skin is sending you urgent warning signals right now, and ignoring them could cost you everything. What you're about to discover will completely change how you view those harmless skin changes you've been dismissing. Your kidneys quietly filter waste from your blood, but when they start to fail, toxins build up, causing serious health issues. One of the earliest warning signs often shows up on your skin. Studies reveal that most people with advanced kidney disease develop skin symptoms, sometimes before other signs appear. These changes are more than just irritation. They're your body's alert system, signaling something is seriously wrong. In this video, we're exposing all 10 warning signs, starting with the most dangerous one that 90% of people ignore until it's too late. Some of these will shock you, and at least 2 of them are probably visible on your body right now. If this information could save your life or someone you love, make sure to subscribe and hit that notification bell so you never miss critical health content like this. Let's dive in. Disclaimer: this video is intended for educational purposes only and does not constitute medical advice. Always consult a qualified healthcare professional regarding any medical concerns, conditions, or emergencies. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Pruritus, itchy skin. The first and most distressing sign we need to discuss is pruritus, commonly known as uremic pruritus or chronic kidney disease-associated pruritus. This isn't your typical seasonal dry skin itch. We're talking about an intense, relentless itching that can literally drive patients to desperation. This condition manifests as persistent itching without any visible rash initially. The sensation ranges from mildly irritating to absolutely unbearable, often worsening at night and severely disrupting sleep patterns. What makes this particularly devastating is the chronic scratching that follows, leading to raw, bleeding wounds called excoriations. The underlying mechanism involves multiple factors working together destructively. Uremic toxins, particularly urea, accumulate in your bloodstream when kidneys fail to filter properly. These toxins deposit in the dermis and are excreted through sweat, directly irritating nerve endings in your skin. Additionally, mineral imbalances create calcium phosphate deposits that further irritate these sensitive nerve pathways. The immune system becomes hyperactive, triggering systemic inflammation throughout the body. Perhaps most importantly, opioid receptors in both your central and peripheral nervous systems become severely imbalanced. This explains why traditional antihistamines provide virtually no relief. The itching operates through non-histaminergic neural pathways that standard treatments simply cannot address. Studies show this affects approximately 90% of end-stage renal disease patients undergoing hemodialysis, making it the most common nonspecific symptom of advanced kidney disease. 2. Xerosis, extremely dry skin. Xerosis represents far more than simple dehydration. This extremely dry skin condition creates a rough, scaly texture that feels uncomfortable to touch. In severe cases, your skin develops a distinctive fish-like scaling pattern called acquired ichthyosis, where the skin literally resembles fish scales. The affected skin feels uncomfortably tight and cracks easily, creating fissures that can become painful and prone to infection. This isn't caused by not drinking enough water. Instead, it results from fundamental changes in how your skin functions at the cellular level. When kidneys fail, they disrupt dermal sweat and sebaceous glands throughout your body. These glands normally produce natural oils and maintain proper skin pH balance. Without proper kidney function, your skin's natural lipid content decreases dramatically and moisture retention becomes severely compromised. Elevated phosphorus levels, a common mineral imbalance in kidney disease, contribute significantly to skin dryness and irritation. Your body also struggles to absorb essential nutrients like zinc and B vitamins, which are crucial for maintaining healthy skin barrier function. Research indicates that between 50% and 75% of dialysis patients experience cirrhosis. This creates a vicious cycle where dry skin exacerbates pruritus, leading to more scratching and further skin damage. The compromised skin barrier increases infection risk, which becomes particularly dangerous for immunocompromised kidney patients who struggle to fight off bacterial invasions. 3. Skin color changes. Kidney disease creates dramatic visual changes in skin coloration that serve as important diagnostic indicators. These changes include an unhealthy pale appearance called pallor, a grayish or yellowish tint, and areas of generalized darkening known as hyperpigmentation. These aren't subtle changes, but obvious alterations that family members often notice first. Each color change represents a specific underlying mechanism. Pallor indicates anemia of chronic kidney disease, occurring when your glomerular filtration rate drops below 60 ml/min/1.73 m superscript 2. This affects approximately 20% of stage 3 CKD patients and at least 90% of dialysis patients. The yellowish tint results from retention of urochromes and keratin, pigments that healthy kidneys normally excrete efficiently. When kidneys fail, these substances accumulate in your skin, creating the characteristic yellow discoloration that becomes increasingly pronounced over time. Hyperpigmentation develops from accumulation of middle molecular weight substances that dialysis cannot effectively remove. These compounds deposit in your skin, creating darkened areas particularly noticeable on the shins and other exposed areas. Anemia in kidney disease occurs due to reduced erythropoietin production, impaired iron absorption, inflammation, and shortened red blood cell lifespan. This understanding guides treatments like erythropoietin-stimulating agents and iron supplements. 4. Nail changes. Your fingernails and toenails provide crucial diagnostic windows into kidney health through specific, recognizable patterns. The most characteristic finding is half-and-half nails, also called Lindsay's nails, which creates a distinctive two-toned appearance that experienced clinicians immediately recognize. These nails display a sharp contrast where the upper half appears white while the lower portion maintains a normal to reddish-brown color. The distal half may show a pink-red or brown horizontal band, contrasting dramatically with the dull white, ground-glass appearance of the proximal half. Muir's nails appear as white horizontal bands on nails, signaling metabolic issues like hypoalbuminemia, which affects nail bed blood flow and protein structure. Lindsay's nails may stem from hormone-induced pigment changes. Half-and-half nails occur in 20 to 50% of chronic kidney patients, up to 84% with azotemia, and 8 to 13% on dialysis, serving as important, though harmless, signs of kidney disease. 5. Edema, swelling. Edema represents one of the most visible and concerning signs of kidney disease, manifesting as noticeable swelling that makes skin appear shiny, stretched, and tight. This occurs when excess fluid and salt become trapped in your body's tissues due to impaired kidney function. 2 distinct types exist. Pitting edema, the most common form, leaves a temporary indentation when you press the swollen area that persists for at least 5 seconds. Non-pitting edema feels firmer and doesn't retain indentations after pressure application. The swelling typically appears first in your legs, ankles, and feet, then progresses to hands and face. Facial swelling, particularly around the eyes and most noticeable in the morning, strongly suggests nephrotic syndrome, a serious kidney condition involving massive protein loss. The mechanism involves your kidney's inability to excrete sufficient sodium and water, causing fluid accumulation in blood vessels that subsequently leaks into surrounding tissues. In nephrotic syndrome, excessive protein loss in urine reduces oncotic pressure in your blood, further promoting fluid leakage from capillaries into interstitial spaces. Edema often begins in CKD stage 3 and worsens with disease progression due to fluid retention. It can cause discomfort, shortness of breath, chest pain, and strain on the heart, increasing the risk of severe cardiovascular issues that may need urgent care. 6. Rashes. Kidney disease frequently produces distinctive rashes that signal dangerous accumulation of waste products in your bloodstream. These aren't typical allergic reactions, but specific manifestations of uremic toxicity affecting your skin directly. The rashes typically appear as small, dome-shaped, intensely itchy bumps scattered across your body. As existing bumps resolve, New ones continuously form, and multiple small bumps can merge to create rough, raised patches with irregular textures. Additionally, you may develop areas of red or dark patches that feel different from surrounding skin. These patches often feel thicker and may have altered sensation, indicating deeper tissue involvement beyond superficial irritation. The primary mechanism involves uremia, the buildup of waste products in your blood that healthy kidneys would normally filter and eliminate. These uremic toxins directly irritate skin tissue and trigger inflammatory responses that manifest as visible rashes. The toxins likely activate the same complex neuroimmunological pathways responsible for uremic pruritus, explaining why these rashes are invariably accompanied by intense itching. This creates a destructive cycle where scratching worsens the rash, while the rash intensifies the urge to scratch. These rashes are common in advanced kidney disease and signal difficulty clearing waste. Severe itching causes scratching, leading to skin damage and higher risk of infection, especially dangerous for those with weakened immune systems. 7. Acquired perforating dermatosis. Acquired perforating dermatosis represents a unique and distinctive skin condition where your body literally eliminates collagen and elastic fibers through the skin surface. This creates intensely itchy papules and nodules with characteristic central horny plugs and navel-like depressions called umbilication. The lesions often display erythematous halos, indicating surrounding redness and inflammation. They typically appear on your back and lower limbs, though they can develop on the trunk and other easily accessible areas where scratching commonly occurs. Sometimes these lesions arrange in linear patterns called coebnerization, where skin trauma from scratching creates lines of identical lesions. This pattern strongly suggests that mechanical trauma plays a crucial role in lesion development and distribution. The pathogenesis centers on chronic pruritus as the primary trigger. Persistent scratching creates microtrauma in your skin, causing changes in collagen fibers within the papillary dermis. These altered fibers are subsequently eliminated through the epidermis, representing the disease's final destructive stage. Histopathology shows keratotic plugs with keratin, collagen, or elastic fibers and neutrophils in epidermal invaginations or dilated follicles, a hallmark of APD. About 10% of dialysis patients develop APD before or after dialysis, and sometimes post-transplant if graft function declines. Lesions usually resolve in 1 to 4 months, but leave permanent dark scars. Controlling itch is key to managing and limiting the condition. 8. Blisters. Blistering skin conditions in kidney disease can be painful, scarring, and signal serious complications. The most notable is porphyria cutanea tarda, PCT, which causes fragile blisters on sun-exposed areas like the hands and face. These often rupture, crust, and scar, with signs like darkened skin, facial hair growth, and milia, small white bumps. PCT stems from a deficiency in the enzyme uroporphyrinogen 3-decarboxylase, leading to porphyrin buildup that reacts to sunlight and damages skin. Hemodialysis does not clear porphyrins effectively, worsening symptoms. Other blistering disorders include autoimmune forms like linear IgA bullous dermatosis, linked to IgA deposits, and common in end-stage kidney disease. These blisters can lead to infection, so correct diagnosis is critical. Treatments range from phlebotomy for PCT to corticosteroids for autoimmune causes. 9. Calcium deposits calciphylaxis. Mineral metabolism dysregulation in kidney disease creates calcium deposits ranging from benign subcutaneous nodules to the life-threatening condition called calciphylaxis. Understanding the difference between these conditions can literally save your life. Calcium deposits usually appear as painless lumps near joints and are generally harmless unless in the fingertips. In contrast, calciphylaxis is a serious condition where calcium clogs small blood vessels, causing painful, purple skin patches that quickly ulcerate and crust. Calciphylaxis causes painful, non-healing skin ulcers with a hard, woody texture, often resembling scleroderma. It results from calcium phosphate buildup due to kidney failure, leading to tissue damage from severe small vessel calcification and thrombosis. Common in dialysis or post-transplant patients, it carries a high risk of death from infection or organ failure. Early recognition and urgent care are critical. 10. Uremic frost. Uremic frost represents the most dramatic and historically significant skin manifestation of severe kidney disease, appearing as whitish powdery crystals or yellowish coating on your skin surface. This striking finding signals profound uremia and impending renal failure. The skin shows frost-like urea crystals, especially on the forehead, limbs, beard area, neck, and trunk. It feels dry, scaly, and may have a strong ammonia odor. This happens when kidney failure causes urea to build up in the blood and exit through sweat glands. Uremic frost forms when sweat evaporates and urea crystallizes on the skin, often due to impaired sweat glands, altered pH, and dry skin. It typically appears when blood urea nitrogen exceeds 200 milligrams per deciliter. Once common, it's now rare in developed countries due to timely dialysis. Though it causes intense itching, its real danger lies in signaling severe renal failure and the urgent need for life-saving dialysis. Was this helpful? Don't forget to like, share, and subscribe for more health tips.